Parts of the body. 2. The abdomen. The main organs of the body have ordinary English names, and doctors use these words, but when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, the pancreas, have no ordinary name. Pancreas, duodenum, gallbladder, liver, right kidney, left kidney, spleen, stomach. When doctors talk about the main parts of the digestive system, they use the words bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. The chest. The chest, thorax, contains the organs of respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into 2 lobes and the right into 3. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separate from the abdomen by the diaphragm. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter. One on each side. The ureters carry the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube, called the urethra, to the outside. Functions of the body. Eating. You are hungry, you are in a restaurant, and the waiter brings for food. You smell it, it stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food. It tastes good, and you chew it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've eaten. Something has disagreed with you. The five senses. The five senses. In addition to smell and taste, the sense include sight or vision, hearing, and touch, also called sensation or feeling. To ask about the sense, doctors use the questions: what is your sight, hearing, sense of smell like, sense of taste like, or is your sight, hearing, smell, sense of smell, or sense of taste normal, sense of taste like, normal, sorry. To ask about the sense of touch, doctors talk about numbness, loss of sensation. Have you noticed have you noticed any numbness in your fingers or toes? Other functions. Functions, verb, noun. Speaking, speak, speech. Walking, walk, gait. Breathing, respiration. Inhale, breathe in, breathe in. Take a breath in. Exhale, breathe out, breath. Urination, micturition. Urinate, micturate, pass urine, pass water, urine. Defecation, defecate, pass feces, pass stalls, feasting, feasting, stalls. Menstruation, menstruate, have a period, menstrual period, or monthly period. When taking a history, doctors can ask, do you have any trouble, difficult problems walking, breathing, passing urine, with your speech, or do you have any pain when you breathe in? When auscultating a patient's lungs, the doctors tell the patient, take a deep breath, take a deep breath in, hold your breath, then breathe out completely. Less common functions. There are some things we do less often. When we are hot, we sweat. We sweat. When we are nervous, when we are nervous, we shake. When we are sad, we cry. Doctors can ask, do you sweat or shake more than usual?